Hi guys, Oscar here with Gastroenterology Simplified. I'm a board-certified physician assistant, and today I want to have more of a conversation with you regarding constipation. It seems like every time I turn on the TV or watch YouTube or go on any type of media, it seems like there are a lot of advertisements for fiber supplements, laxatives, stool softeners, medications such as linzess to assist with IBS-C. And I see a lot of commercials for that. That means that there must be a market. I practice GI and I see that a lot of individuals complain of constipation. So this made me think, is the United States chronically constipated? Is this an issue that is increasing in prevalence here in the United States? So before we go any further, I want you to understand that this video is for educational purposes only. If you have any questions, concerns, or any type of symptoms, always contact your primary care physician or your physician assistant. So constipation has become increasingly common over the past several decades, especially in the industrialized countries like the United States or any other Western countries. Before we go any further, I want you to understand that I grew up in Venezuela and our diet consisted of a lot of fruits, fresh vegetables, and constipation was not really an issue. So that's why I want to compare what I grew up with to what I'm dealing with here in the United States, at least with the people that I deal with, right? While the exact numbers vary depending on how constipation is defined, it shows that the increased visits of people complaining of constipation has increased. So the office visits to see their doctors. And let me give you some numbers here. Back in the 1980s, about 2 to 5% of individuals, adult individuals, complain of chronic constipation. Then from the years 1990 to the year 2000, about 12 to 15% of adults complained of chronic constipation. From the years 2010 to the years 2020, about 15 to 20% of adults complained of chronic constipation. We see a trend here. For the past 40 years or so, chronic constipation has been increasing. But why? Why? In the years 1990s to the year 2000, there was an increased recognition of people dealing with chronic constipation, and the aging population was also complaining of constipation. If you have ever discussed or talked to an elderly, let's say someone over the age of 70 or so, they are so focused on making sure that they have a bowel movement. So once you get to that point, you're going to notice that the elderly are very worried about bowel movements. And then from the years 2010 to the year 2020, constipation percentage went up, but there was a link. There was a link in physical inactivity, sedentary lifestyle, the increased intake of ultra-processed foods, increased use of medications, and gut disorders. In the late 1980s, a study estimated that over 4 million Americans had frequent constipation with a prevalence of about 2%. Now, reports show that 16% of the United States adult American experience constipation symptoms, and that number has increased to an estimated 33% of the entire population over the age of 60. So this makes sense, and I'm saying the age of 70 because that's what I noted. I have noticed that people 65 and over are very concerned about their bowel movements. Modern epidemiology studies now commonly estimate that constipation affects about 15% of the United States overall. Just overall, 15% of the Americans are experiencing constipation. But why? Why, if we are an industrialized country, the richest country of the world, we have the greatest and best technology, why constipation keeps going up? At least when I grew up in Venezuela, that was not an issue. Constipation was not an issue because we had fresh vegetables, fresh fruits, lean meats, and we bought our foods every other day or so because we would get fresh foods, right? And likely, I must say that likely that's the reason why a lot of individuals were not experiencing constipation. And keep in mind that I grew up with my grandparents and they were very, very focused on their bowel movements. They were also very focused on eating healthy foods. So, what are some of the factors that could likely explain the increase of chronic constipation in the United States? I believe this is common sense, but I'm going to go ahead and say it here. The lower intake of fiber, so fresh fruits, vegetables, and other fresh foods, and the increased intake of ultra-processed foods. Also, Americans have become more sedentary, lack of inactivity, higher obesity rates, increased use of medications that actually slow down the GI system. And are you ready for this? First, opioids. Opioids are known to slow down the GI system. And in fact, there is a diagnosis called opioid-induced constipation. And you have a medication that causes constipation, but then you have another medication that helps to have a bowel movement for the opioid-induced constipation. Then we have antidepressants. It seems like the Americans have increased their intake of antidepressants, and this pretty much calms your entire body. Therefore, your GI system slows down. And are you ready for this one? This is the one that truly drives me nuts. GLP-1 medications. You all know that, such as Wegovy, Ozempic, just to mention a few. We also have iron supplementation, which are known to cause constipation. Aging population, anyone over the age of 60. Also, stress and the disorders of the gut and brain axis. And of course, people have become more aware of their bodies. Therefore, they tend to seek more help when it comes to constipation. Women and older adults consistently have the highest rates of constipations across decades when compared to the male. Increasingly, some research believes that constipation may be more of a modern lifestyle disease. Let's repeat that again. Yes, constipation seems to be more of a modern lifestyle disease than many people realize. Diet rich in ultra-processed foods, low of physical activity, have a very strong link in the increase of chronic constipation. The link of the ultra-processed foods, as well as the lack of activity, of physical activity, have contributed to the increase of chronic constipation for the past 40 years. Now, On the other hand, recent research have also suggested that a Mediterranean and plant-based diet have known to decrease chronic constipation or the risk of chronic constipation. So if we could learn something from this conversation that we're having here, is that the ultra-processed foods, lack of intake of natural fibers, lack of activity, lack of drinking water, at least drinking 64 ounces of water per day, are likely contributing to the increased visit, and when it comes to the healthcare, increased visits of chronic constipation, people complaining of chronic constipation. And we could go back to the numbers. We have, back in the 1980s, only up to 5% of the population was complaining of chronic constipation. And then we go to the year 2020, and it seems like up to 20% of adults complain or are experiencing chronic constipation. Now, what can we do about this? I mean, I think, in my opinion, this is my opinion, all right? I think the fix is very easy. I think if we focus more on eating the fresh foods and increasing physical activity, also increasing the intake of water, at least 64 ounces of water per day, I think this is going to at least reduce the risk of chronic constipation overall, just by doing that. I know, I'm completely aware of this, that some people, some individuals may benefit and must be on antidepressants, opioid medications, and maybe, which I don't agree with this, but some individuals are on GLP-1 medications, which are not supposed to be on GLP-1 medications, are also experiencing chronic constipation. And overall, this would be drug-induced constipation because the medication that you're taking is contributing to the slowdown of your GI system, therefore causing constipation. And I believe, once again, my opinion, I believe that the fix could be easy, but there must be education when it comes to the proper diet and telling people, hey, avoid the ultra-processed foods. Try to focus more on fruits, vegetables, lean meats, and so on to help with the condition. Lastly, and I think there is a monetary factor here, or a profit here, that drug companies, they make the medication that people are likely benefiting from, and then they make another medication to treat the adverse effects of the medication. So not only this drug company is making money from this medication, but it's also making money to treat the adverse effects that this medication is causing. And I think there is a factor that they're making money. I mean, they're just making money and their profits go up where the American population suffers, in my opinion. That's just my opinion, all right? Now, if you are an individual that is experiencing constipation, chronic constipation, of course, you should always contact your primary care physician, your physician assistant. Make sure that you have the studies done. Make sure you try whatever they recommend for you to do. And hopefully the chronic constipation resolves. Because according to the studies and according to the information that I have been able to gather, and according to the information that I have been able to gather across my patients, it seems like the common issue is the same. Number one, the high intake of ultra-processed foods. Number two, the lack of inactivity. Number three, the lack of drinking at least 64 ounces of water per day, and lastly, the drug-induced constipation. If you found this video helpful, don't forget to follow Gastroenterology Simplified for clear and simple medical education. Once again, I want you to understand that this video is for educational purposes only. And if you found this video helpful, don't forget to click like, subscribe, and I will see you on the next one. Have an amazing day, and let's go walk.